Hello everyone, my name is Zainab and I'm a nursing assistant. In this video, I'm going to demonstrate how to perform a proper bed bath.
To enter a patient's room, introduce yourself and explain the procedure. Knock firmly on the door before entering to respect the patient's private space. Introduce yourself. Pause briefly for permission. Perform hand hygiene immediately. And wear gloves. Reminder, always obtain informed consent before starting the procedure. This means asking the patient for permission before touching them. For security and patient verification, always ask the patient for their full name and date of birth. Following verbal confirmation, check the patient's ID wristband to verify their identity. Prior to beginning the procedure, get a clean water and ensure it is warm and comfortable, ideally under 115 degrees Fahrenheit, 46 degrees Celsius. However, always ask the patient for their preferred temperature. To maintain proper ergonomic and protect your back from strain, elevate the bed to waist to hip height before initiating care. Lower the headrest of the bed and put down the side rails, then fold down the top linens to allow a clear view of the body. Effective communication is vital. Always inform the patient before performing your next action. Position the patient in a side-lying position. Hold their right shoulder and hip. Gently roll them toward the side rail and ask them to hold on to it. When the patient is in a side-lying position, fold the Macintosh in half and place a rolled clean towel next to it. Remove the pillow and replace it with a towel to prevent it from getting wet. Position the patient in a supine position. Tell them that they will feel a large bulge under their back, but explain that it is only the towel. Secure the side rails before transferring to the opposite side of the bed. Place the patient in a lateral position to facilitate the removal and disposal of the Macintosh. Straighten the underlying towel before returning to the primary working position. Return the patient to a supine position and lower the side rail. Next, place a clean top sheet over the patient to cover their body and maintain their dignity. First, face and head. Use a damp washcloth without soap to avoid irritating the eyes. Use the four sides of the folded cloth for each area being cleaned. Wipe each eyelid gently from the inner corner outward. Wash the rest of the face, ears, and neck. Then pat dry. Second, arm and underarm. Support the patient's arm at the joints and remove the gown. Use firm strokes moving upward from the hand and wrist to stimulate blood circulation. Wash the palm, the back of the hand, and carefully clean between each of the fingers. Then, gently lift and support the arm to fully expose and clean the armpit. Third, chest and half of the back. Wash the chest with gentle strokes. If the patient is female, gently elevate the breast to clean underneath. Then, turn the patient onto their side to wash the exposed half of their back. Lastly, legs and feet. Wash from the thighs down to the ankles. Wash the feet, make sure to clean and dry thoroughly between the toes. Replicate the entire washing and positioning procedure on the opposite side. At this point in the video, change your soiled gloves, perform hand hygiene, and put on a fresh pair before handling the patient's clean clothing. Putting clothes on a patient, starting with the lower body, is a standard nursing practice because it provides the best combination of patient safety, physical stability, energy conservation, and personal dignity. Bunch up both legs of the pajama pants, slide the pant legs over the patient's feet, and pull them up as far as the thighs while they are lying flat. Gather the sleeve of the shirt into a ring in your hand. Gently support the patient's arm at the joints, wrist, and elbow and slide their hand through the gathered sleeve. Bring the sleeve all the way up to the shoulder. Roll the remaining fabric of the shirt lengthwise. And tuck this rolled section underneath the patient's back so it sits right next to their spine. Next, move to the opposite side of the bed. Turn the patient slightly toward you to reach behind them. Pull the rolled fabric out from under their back. Align the front of the shirt and button or snap it closed. Discard the soiled top sheet into the appropriate laundry bin. Assist the patient into a side-lying position to remove the soiled towels. Place a clean Macintosh and replace their pillow before returning them to a supine position. Move to the opposite side of the bed to ensure the Macintosh is properly positioned. Upon completion of the procedure, promptly reposition the clean linens over the patient to ensure thermal comfort. Before leaving the patient's room, always return the bed to its lowest safe position. Ensure the appropriate side rails are up and securely locked according to the patient's care plan. Place the call button or call light directly within the patient's immediate functional reach and assess their immediate needs. Finally, move the bedside table back next to the bed so their water, phone, and tissues are easy to grab without stretching. Thank you for watching. I appreciate your time and attention.